Good morning and welcome to The Point. It is Wednesday, April 28th, 2021. Thank you to those of you joining us on the GBN Grenada Broadcasting Network's Facebook page, the GBN Production YouTube channel, the website www.gbn.gd, GBN TV channel 7, 11 and 20. Good morning to the listeners of Classic 105.5, 105.9, as well as the folks joining us on Party Grenada and Go To Fet Facebook pages. Always a pleasure to have you. Thank you so much for tuning in. This morning, my virtual guests are representatives from the Ministry of Health. And Social Development. I have joining me is Minister Delma Thomas, PS in the Ministry of Health, Hannah St. Paul, and Nurse Audrey Lyons, who is the Immunization Manager. Good morning, ladies.
Good morning to you, Blossom, and good morning to all the listeners of GBN To The Point program.
Appreciate it. Minister, could you just center yourself a little bit? You're in an end. Right. Lovely.
It's better?
Better. So let's start, ladies. Minister, let's get an overall update before we get into specific details. Let's get an overall update on how, since your appointment for responsibility for hospital services, what are some of the latest developments coming out of the hospital and the administration of the hospital and the things you've been able to do since your appointment?
Thank you, Blossom. Let me first say that we are glad for the opportunity to be able to inform the nation as to the progresses we are making in hospital services and general health care of Grenada, as well as to talk front about the challenges, because as you will be more than acutely aware, there are always challenges. But as a general point, I am here to report that we have made remedial progress within the last few months to advance the quality of healthcare, especially at our hospitals and community health services. The system is never perfect and we shall be never satisfied. But we are happy that things have begun to move the right direction, and the improvement in services could not come at a more opportune time given the global pandemic we have been facing along with the rest of the world. Together with PS St. Paul and Nurse Lyons, who will speak about vaccination and immunization in general, not only about COVID vaccination. And PS will elaborate on some of those issues and the services that we are providing. I want to take this opportunity, even before we get fully started, to acknowledge and honor all our healthcare professionals. They have performed very well against many challenges, especially in this era. We owe them a debt of gratitude, and we owe them something even more. Their general condition and remuneration are things we are cognizant of, and this we are determined to address in short order. But the lines of communication are open, and we are determined to get it right. Hello?
Yes, you're still on.
Yes, I wasn't seeing you. I know he's my thing.
Possibly.
Yeah. So we have started, as we have reported earlier, we have introduced new services, and we have spoke before of decentralization of services at the level of the community. And so PS will give details of what we have done as it relates to outpatient services at the different districts, including Princess Alice Hospital. I recall in the last budget, we spoke of some of the services that will be provided, and we have started already with some of the services that PS will elaborate on. But just to say that we have promised the people of St. Andrew and surrounding areas that in the budget, we have said to them that very soon we'll provide you with new services, laboratory services, and we also working on providing small surgeries at that hospital, so not major, but minor surgeries, and also radiology. So in short order, we will invite the media as we fully launch, maybe by the end of the next quarter, at the end of the second quarter, when we'll start to provide that service of lab and radiologists and small surgery at the Princess Alice Hospital. We have already started the process. We have most of the equipment here for some of the services to be provided. And so we are working to finalize and to do the final infrastructural work that needed to be done there. And soon we will be reporting to the nation that these new services have started there. Recently, we have a cardiologist at the General Hospital, so we are now providing cardiology services. And we also have a new urologist that we spoke about before. And we are pleased to announce that he's here and started to work maybe about a month ago, I think, or 3 weeks ago. So we are doing a lot in terms of what we know, that there are a lot more to be done, and there are many issues that confront our people, and we are targeting and being able to deal with those issues. We do still have issues as it relates to staff. We do still have the issue of shortage of nurses and the issue of our nurses' tenure for employment that we are constantly working with and meeting on a regular basis to address and tackle those issues that confront the healthcare sector.
So, P.S., I guess you can go ahead in relation to the outpatient services that the ministry has been able to provide over the past during the first quarter of the year.
Good morning, Johnson, and to all of your listeners on GBN radio and television. We are proud to report today that we have been making strides in order to be able to provide access to quality health care to our citizens, all of our citizens. So over 2020 into 2021, within hospital and community, we have been doing a lot, I would say, despite of the challenges that we currently face, especially our human resource challenge as it relates to medical and nursing professionals. However, we were able to achieve a few of our objectives. And one of those, before we go into that, we would have looked at access to healthcare. We looked at increasing our human resource capacity, and also we would have addressed some health infrastructure. Decentralization of services. The decentralization of services allow for persons within the rural areas to access service that normally they would have to journey all the way down to General Hospital for. So we have been doing this incrementally and in a phased approach, because as I said previously, one of our challenges is human resource. And so far we were able to bring into the community or add to the community our pediatric specialist clinics. So at the Guelph Health Center now, we would have added pediatric service there. We have also added to Princess Alice, Soteres Health Center, and Carriacou ophthalmology services. So with all of the other specialist services that currently is happening, like obstetrician and other things, we now have added these 2 services into community and our subsidiary hospitals. So persons can access. These services are accessed through a referral system as all of the other services. So your general practitioner, your district doctor has identified an issue, they give you a referral, and you go through the appointment system to get access to the specialist. We have also added at hospitals some new services and additional services, and we upgraded some of these services. We have our cardiologists, and we want to speak loudly of that this morning, because prior to we having a cardiologist attached to our assigned to our staff, the only access that the public had to cardiology services was through the visiting team of SGU from time to time. Today we can boast that we have a resident cardiologist and our staff at the hospital. This service provide assessment, cardiac assessment. We also have electrocardiogram is being offered, and echocardiogram. So now we have no issues as it relates to this cardiac service for our people. The cardiologist is operating 5 days per week at the General Hospital. And as I say, all specialist services, you go through a referral system. Dr. Tristan, we would have announced prior that he is a pediatric specialist and urologist. He has now joined us from the 6th of April. He is on our staff, so he would be addressing all of our urology cases, and he has started surgery. So we are seeing our numbers that was waiting on that list is presently being decreased. Nephrology. Dialysis has been something that has been talked about within our health system for some time now. And we are proud again to say that we now have a urologist assigned to our team at the General Hospital. This is a service that we were getting support from SGU, but now we have our own. We have added 2 specialist nurses, nephrology nurses, to that department. And currently, we have the construction work being done on the dialysis unit. That construction work should be completed in the next 2 months. We have all of our machines and supplies and on island for dialysis. So as soon as that construction work has been completed, we are looking to offer our dialysis service in the very near future. And that service would be offered to persons that are living with chronic disease. So we are looking for greater access in very new recent time. Our human resource capacity, as I said, for dialysis is present on island. So all we are waiting on now is the completion of the dialysis unit. Radiology services. The radiology unit has been completed in the 2nd phase of the hospital building. All of the construction works has been completed. And right now, what we are doing is the technical aspect in order to get the installation of the equipment. And radiology services will be expanding to where we will be now offering investigations like CT scans and mammogram. Laboratory. Our laboratory service, we have a brand new lab. I show Blossom, you would have seen GIS would have a little preview of what we have.
Yes, I saw it.
Yes, so that lab is equipped with over $1 million worth of equipment. And because of that, it allows us to be able to add new laboratory investigations to our current list. Then these are long-term goals. We have added human resource capacity to our lab. We have 4 technicians from Cuba who we have added recently, which would allow us, and our long-term goal is to be able to deliver the lab results to our patients within 48 hours. And also some of the investigations that we now have to send to Trinidad and Barbados to access, we can be able to provide those services at our lab. So the lab is transitioning into the new building. The staff is much more comfortable, and we are putting everything in place to ensure that the service there can be a really efficient one. We have also added a data entry clerk to that department because of the recent COVID-19 PCR results. We had, the demand is so great. So we had to increase the data entry department to ensure that persons can get their results in a timely manner, especially persons who have to travel. At our I ward, that we'll call it, the ophthalmology, we would have upgraded ophthalmology. The equipment there now are brand new, and they have access to several different things that they can utilize to provide service. Cataract surgery was one of the things that was on hold for some time. That surgery recommenced, and we now have our cataract surgery up and running. However, I must say that in everything, the COVID-19 has caused us some difficulties in relation to getting our supplies in Ireland. The logistics of shipping has been really, really difficult. And because of that, we have delays in getting our supplies. And these delays are causing that particular surgical operation to be a bit slow. So we are asking the public for their patience. We are going to get to you However, this situation is beyond our control, and we are trying as much as possible to address it so that we don't have to delay you too long. Surgery. I know persons, this is an area that persons have always had a concern about. Our surgical department. Our surgical department has been restructured. We have now operating in a manner of teams. And as a result of that, we were able to reduce the waiting time for persons waiting to have surgery done. And I can say that anyone accessing our outpatient clinic or specialist clinic service for any diagnosis relating to cancers and has to have a surgery done, that surgery is done within 1 month. And if someone has any other reason for surgery, that surgery is done within 4 months. And we are very, very proud of that team for making that effort and commitment to improve that long waiting time that persons would have had so much concerns about over the years. I want to assure you too that your complaints will be addressed. So if there is anyone who would have accessed care and have some difficulties, some challenges or concerns, I am urging you to put your concerns in writing to the medical director, and these concerns will be addressed because our aim is to improve care. The NICU, or our neonatal unit, that is our specialized area for caring for a newborn. We are now doing construction work, so we are going to be providing a brand new wing for our newborns. So we have a greater capacity to house and care for our newborns. And this area is expected to be completed from the 7th of May. So soon, our newborns would be cared for in a brand new facility at the hospital. We have also in hospital installed 2 brand new elevators. And these elevators are necessary because our operating theater, we know, is at the 4th floor. So to get patients to the operating theater for surgery, emergencies from time to time, patients that cannot walk, so you have your bedridden patients that need diagnostic investigations like your ultrasound and so, they have to be moved. And in order to do that, we need the elevator to get them from one floor to the next. And we know we've been having some challenges with our old elevators. So we have removed these elevators and we have 2 brand new elevators that is now functioning. Somebody want me to continue, or do you have a question?
Well, I could ask questions actually. I wanted to get to Nurse Lyons because in the midst of all the projects the ministry has going on with all the construction and so, this week is also vaccination week. And so I just wanted to ask, what have been the numbers so far? What were some of the aims and objectives of the week, and how close are you to meeting those objectives? On mute. All right.
Good morning to you, Blossom, and special good morning to our Minister, Honorable Delma Thomas, and to our Permanent Secretary, Mrs. Hannah St. Paul. Good morning to viewing and listening audience. Every year, the region of the Americas celebrates Vaccination Week, and this year is no different. This year will be celebrating 19 years of Vaccination Week in the Americas. And Grenada, of course, has a variety of activities to celebrate Vaccination Week. We also have COVID-19 added vaccine to this year. However, I would not just speak on COVID-19 vaccine alone, but we have in Grenada here, we have incorporated 9 vaccines that can, in our vaccination schedule, that can assist in preventing some vaccine-preventable diseases, measles, mumps, rubella, diphtheria, pertussis, tetanus, polio. And in 2018, we have incorporated the vaccine HPV, human papillomavirus vaccine, to combat cervical cancer. In introduced it in 2018 for the 9 and 10-year-old girls. Vaccines, we also have our yearly influenza vaccine, which is not however, over the years, we notice a steady decline in our coverage. And this, I think, is due to maybe some misinformation that circulates via social media. We would have gotten, prior to 3 years ago, 90 to 95% coverage against our vaccine-preventable diseases. But we notice that we have a lot of vaccine hesitancy, not just now, as with the COVID-19 vaccine, but within the last 3 years. So our coverage has started to decline to about 85, 89% thereabout coverage. And so I would like to make an appeal to public parents out there that vaccine plays a role. You know, it's a critical tool from protecting us from vaccine-preventable diseases. I would advise the general public to pay attention to the various reliable websites where you can get information, talking about WHO, CAFA, PAHO, even the Ministry of Health Facebook page. Instead of you being drawn to more of the negatives. However, as of February 2021, we introduced the COVID-19 vaccine here in Grenada. As of yesterday, we had 12,445 persons accessing the first dose of the vaccine, and 2,105 persons so far had their second dose. And this is just a little above 10% of our population. We're hoping that we can protect as much people as we can with the COVID-19 vaccine. Where focus, as I said, is on COVID-19 vaccine at present, at the moment, we would like to ensure that our routine vaccines, we have adequate coverage for them. So we have a list of activities that we plan for vaccination. And so far we started with a church service, which was held at the Tillery's Pentecostal Church last Sunday. It was well attended with various healthcare providers. Our minister was present, our permanent secretary was present, and so was members of the committee. On Monday, we had vaccination outreach to the bus drivers and operators at the bus terminal St. George's, where we had a fair uptake of the COVID-19 vaccines, and we also offered other services such as blood pressure check, blood sugar screening, eye screening, and so. We also, and this is an effort to increase our vaccine. Yesterday, we went to Montu, just outside the Seventh-day Adventist Church, and we did outreach in that area, various blocks and so, just to reach and meet people. The Radisson's is presently open, so persons can access vaccination there daily, 9 a.m. to 2 p.m. Vaccines can also, and all vaccines we're talking about now that are part of the immunization schedule, and also the COVID-19 vaccine can be accessed at all of the health facilities daily for this week. And if you need to have the COVID-19 vaccine at any of the healthcare providers, that you call in advance. And the reason for this is the vaccine comes in 10 dose vials. So to avoid wastage, we advise that you register. Once we have the 10 persons, then we give you a call and we'll be sure to get your vaccine. We give you a date and a time to come in and we will vaccinate. Okay. Today, vaccination at various health clinics and at Radisson's. Later on this afternoon, we'll be doing a meet and greet at some villages in St. Andrew, Paradise, Telescope, Mount Horn. A meet and greet to meet the people and to sensitize them and encourage them on the importance of vaccine. Tomorrow, please the Lord, we continue the COVID-19 vaccines at Radisson's, and we're looking to do outreach on Friday at the bus stop. We'll be doing a health vaccination at the bus terminus on Friday from 10 a.m. to 5 p.m. So we're encouraging everyone, okay, you had your first dose already, those especially who had their first dose in the cinema in Grenville, feel free to come in at the bus terminus on Friday, this Friday, from between the hours of 9 a.m. to 5 p.m. And for those who just mind, it's open to you also. It is 18 years and over. Feel free to come in to get your COVID-19 vaccines, and you can access the other vaccines at the clinic. However, we'll be there also to have your blood pressure, your blood sugar test, eye spray. The nutritionists will be there. The health and environmental officers will be there. The social worker will be there. If you have any questions, concerns, feel free. So it's going to be an expo. And also we have a poster competition among school children, grade 4s. So we'll be rewarding them on that day too, who has the best poster. And our theme for vaccination week, vaccine bring us closer, #GetVax. So I encourage each and every one of you there who will be listening to ensure that you access vaccine, whether it can be the COVID-19 vaccine, the MMR vaccine for your 1-year-old and your 8-year-old children. Those of you who still have questions or concerns, feel free to reach out to your healthcare providers, and they will guide you accordingly.
On that note, ladies, let's take a quick break and then we're going to come back with some more. This is To the Point. We're speaking with officials of the Ministry of Health and Social Development, Minister Delma Thomas, PS Hannah St. Paul, and Nurse Audrey Lyons. To the Point, we'll be right back.
Do you hear what I hear? Listen to the ocean, and you will hear a cry for help. The ocean is hurting, and we are the source of the hurt. But we can stop and start to heal our ocean by preventing pollution from getting into our waterways. It can start with you. Join an active organization, or better yet, make a personal commitment. Commit not for just one day in the year, but for the rest of your life. Let's dispose of our plastic and other waste responsibly, and let's start building resilience. Let the healing begin.
This message is brought to you by the OECS Commission with funding from the Government of Norway. Remlit, tackling ocean pollution from turf to surf.
Scholar, you know, people, they have a meaning for everything that happens. For example, they used to tell you, if your ears ringing, somebody calling your name.
Yeah, you're right. And if your left hand scratching you,
you go get the money.
And you're right.
You have to pay the money.
You're right.
But the problem is now something happened, and I kind of worried because Doc tells Susan pinched somebody, and the person pinched me. Doc say he noticed a sudden change in receipt modus operandi about 2 months ago, and after that we see him about fish, so that worried.
we born G. So 619 then.
Doc C is he watching you because you get a bigger piece of cake when we see us sharing cake.
Chance, I don't bother with you. Doc know for a fact I don't bust bile.
Well, Friday on We Culture, folks, we go find out who busting bile and who ain't busting bile. Make sure to join us on We Culture this Friday.
Mr. Man, don't put that thing in Doc head.
Doc watching you.
Don't put that, the small piece of cake, man, that's supposed to watch.
Doc watching you.
Doc, the small piece of cake, man.
Kindly greasy pole, and we don't dance from the maypole.
Can you spend wisely and have more savings? Yes, you can. Learn more with Money Matters on GBN Television. The Money Matters series explores 12 top ways to save money. In this series, you would learn how to save by setting up your spending money right. Save on vehicle loans, home improvement projects, your credit cards, and even on prescription drugs. Tune in every Tuesday morning at 7:15 for Money Matters, a lighthearted conversation with financial planner Tali Francis. Follow the rebroadcast on Thursdays at 6:50 p.m. and on Sundays at 7:30 p.m. Money Matters is a financial literacy public awareness program sponsored by Republic Bank Grenada.
Republic Bank, we're the one for you.
Welcome back to the Point, speaking with Minister Delma Thomas, PS in the Ministry of Health, Hannah St. Paul, and Immunization Manager Nurse Audrey Lyons. It's at this point in the program we're going to invite our viewers and listeners who may have comments, questions, queries, concerns in relation to hospital matters, and possibly the other ministries the minister is involved in, social development and housing, but really we're focusing on hospital services. The landline number 435-2041. That's also the WhatsApp number. Please, only written messages on WhatsApp. No voice or video calls, no YouTube links, no videos or pictures, only written messages. And you can also continue to post your comments, questions, queries, concerns on the GBN Grenada Broadcasting Network's Facebook page and the GBN Production YouTube channel. Let's go to our first caller of the program. Good morning, caller.
Yes, good morning, citizen Welsh, and greetings to your guests. I do hope that they can hear me, because some of them hear conveniently, you see. Now, I am making this, I'm asking this question because I'm concerned about the inefficiency at a certain level of the health services in this here country. I am scheduled for Friday the 30th of April to receive my second vaccination shot. Consulting the medical system center in Wester Hall, I'm now being told that I will have to come Monday because on Friday there are no services. You know, I hear these people talking with alacrity of certain services being offered 5 days a week as if medical services and so on have holidays and vacations, that on Fridays, Saturdays, and public holidays we can't get service. I want to know why in 2021 we have in this situation in this here country. The second thing I'd like to ask the minister, what plans she has in relation to domesticating the laws relative to people with disabilities in this here country in compliance with the United Nations Convention on the Rights of People with Disabilities, who in this country, everybody know, catching the royal nenen and being used for their own political expediency, a matter which has to be dealt with and stopped immediately. Thank you very much and have a nice day. Will ya?
Thank you very much. Ladies? Anybody? Minister, Mrs. St. Paul, anybody?
I did not hear clearly what he raised.
The first point he made was the opening of health centers. He has to get his second COVID-19 vaccine shot on Friday, but the officials at the Wester Hall station told him he can't get it on Friday. He'll have to come on Monday. So he was concerned or questioning why is it that some health centers operate on a 5-day-a-week schedule when it's really health matters.
Let me just answer this, please. We know that there's a nurse assigned to Wester Hall Medical Station 5 days a week. However, he said he's scheduled for Friday and they asked him to come Monday. Maybe it's because we did not get the 10 persons to make up that vial for the vaccines. So maybe that could be the reason. But there is an officer assigned to Westerholt Medical Station there daily. So that could have been the challenge there.
And Minister Thomas, he also asked about if you have any plans of developing facilities that can better facilitate members of the disabled community.
We have always looked at, in terms of when we do new infrastructure, to ensure that we make it accessible for persons with disabilities. So any new facility that is being developed will be developed in such a way that persons with disabilities can access easily.
A Facebook question, well, a comment really. Somebody on Facebook says, it's really shameful to hear government officials telling the nation about the shortage of nurses when the same government is responsible for the closure of the nursing school of Grenada. They also chose to issue contracts to those nurses that are there. How are you expecting them to remain in service under those conditions?
It's a comment, so you don't want me to respond to a comment.
Well, the last piece, how are you expecting the nurses to remain in service under those conditions?
Well, the issue of nursing leaving, so then maybe the conditions you're talking about, we agree that there is an issue as it relates to nurses with the contract, and we are working on it. But we must appreciate that nurses are leaving in every country. Nurses are looking for maybe to go overseas and all that. So it's not a case that you can say it's just about contract and those issues that you're saying. We try to wrap our fingers from the health, from our standpoint as Ministry of Health, on some of the issues, because some of the people that are leaving are the ones who have permanent jobs. Not hardly you're seeing those. Is really those midwives and stuff who are permanent. So the issue is not really contract. We still trying to analyze that. But as I said, we're seeing nurses living in Barbados, Trinidad, and all the other countries, and they are going to the UK and other countries. We also see nurses living from UK. The reason why the UK need our nurses is because their nurses are living and going into other areas. So it's an issue that is a worldwide issue. It's an issue that we're looking at. And as it relates to training nurses, as government, we are committed to training nurses. Just recently, we signed that memorandum of understanding with TAMCC on starting back the midwifery program, which will be started in September. We will be working as government in providing more scholarships for our students, our people to get into nursing. We appreciate that there was a mandate from the OECS, as I was told, that nurses should start up at the level of a bachelor's degree. The nursing school we're talking about is a certificated program. So it means that in order for us to continue, I am saying the best way is through St. George's University, and that government will commit to provide more assistance and more scholarships and more training for more nurses, so that we will be able to deal with that issue in the long term. However, we will look at strategies in the short order, but we are working consistently. So just last Monday evening, we met the two of the nurses we have here, two of the persons we have, PS and Nurse Lyons, and the rest of the team will to look at how we move forward. So we are continuously working to improve. And yes, I agree that there are challenges as it relates to nurses and their contracts, but we are working fast on those particular issues. But the truth is, when you question the nurses, if you get prominent to there, if we increase that, would that stop you from leaving? And some would still leave. So there seems to be a bigger issue that we're still not able to identify at this time.
Good morning, caller.
Good morning.
Morning.
How are you today?
I'm good.
Good morning, Ms. Delma. Hello?
Yes, go ahead with the question.
I just tell, you know, congratulations with all the work she's doing. Tell Miss Emlyn T., Miss Simeon, who used to be in Croshoe, say hello to her and to her family. Tell her to keep strong. And all members of the government, keep strong. No matter what is going on around you, keep strong. The devil is alive and well, but when you hang on to God, nothing is impossible with him. Have a good day.
Thank you very much. You enjoy your day as well. You got the message, Minister? Somebody was just saying hi. Okay, so let me go to the WhatsApp. Somebody on WhatsApp is asking, can you provide an update on the bug infestation at the Mount Gay Mental Hospital?
Yes.
Sorry, Minister, on mute.
PS can speak to that, but at present, this is something that we have already dealt with, but PS can give details.
Yes, please. Mm-hmm.
Yes, Blossom. The bug infestation, we would have dealt with that issue. We would have had a private company with pest control that would have addressed the issues of the bug infestation. And we have monthly treatments being done at Mount Hospital in order to prevent reoccurrence. We have also since get rid of all the mattresses and clothes and all the things that was there and replace them with brand new mattresses. We would have purchased 130 mattresses over the period of time, ensuring that every patient have access to a mattress. And we are currently now in the process of changing out some of the beds that we have. As we know, we are in an economic crunch. Therefore, we cannot do everything at one point in time, but we are doing it in stages, and we are at the area now where we have to change out the beds. So we are sourcing because we have to get special beds for Mount Gay. You can appreciate the patients that we house, so it's not like you can get that readily available anywhere. So we are presently sourcing those beds so we can change out all of the beds there at the facility.
All right, let me go back to Facebook. Somebody on Facebook says, last Sunday it was said that the Hilarion home in St. Patrick does not have a pot to cook food for the seniors, in which a Good Samaritan in New York had to mail a pot in a suitcase. The question, how can you always say we're a caring government and yet seniors who made great contribution to the development of the country and something simple as a pot not available for cooking? Can you tell us what your government is doing for our senior citizens? And I am inviting you to visit the home in Sateas and how much money has been given to these homes.
Well, I cannot tell you at this point how much money, but what I can say is that government gives subvention to homes, to some of the homes, to some of the private homes, and families are responsible for making contribution for relatives in homes. So there is a cost for residents at the home. So I cannot speak to the fact that there is no pot. The first time I'm hearing that is as you're saying it now, or you're reading from that comment. But the issue of utensils and all that will come from the subvention and the monies that is collected from residents at those facilities. Because government do not give pots and spoons and all that. They give a subvention, and as I said, relatives, there's a fee that a relative must pay for each resident at the home. There are residents that can pay and may receive the seed benefits, and so that $300 will go or should go, because sometimes family collect and we have to investigate because they do not pay. But that should go towards the home from government. So the subvention will enable persons who cannot pay. But in a general sense, family members are supposed to pay for the care of their relatives at those facilities.
Good morning, caller.
Hi, good morning to you and to your guests this morning and all your followers. First of all, let me compliment the ministry on the the work they have been doing in terms of protecting us against COVID. And of course, the cooperation we've gotten by and large from the population. I think Grenada has done an excellent job, and I think the leadership from that ministry must be complimented for that. Also, Minister, I'm very impressed to hear about the slate of improvements you have made and the changes. I guess it will start to impact on healthcare, eventually. But my question is, first of all, why did it get so bad that you almost have to start from scratch? Now, who presides over the demise of that system that you have to actually pick it up from the ground? This is very worrying. The other concern I have has to do with the immunization. Am I still on?
Yes, you are.
Right. First of all, my dear lady, the immunization officer, I have been vaccinated, so I could speak openly and honestly. I took a personal decision. But while you may be an immunization officer in general, I think we all would agree that in terms of COVID, we are not actually providing immunization. So I guess for the other things that you immunize against, fine. But for COVID, I think we are not really doing that. But I'm not knocking the system. I'm just trying to clarify something. But my major concern is this. Because of the situation with the vials, I've heard of many people who have been frustrated because you should have a system there that you call the people who are on your waiting list every other day or something like that. There must be a system. People can't be just there waiting. One guy waited for 2 weeks, he told me. And then he had to go to one of the medical stations and then put his name again. There must be a better way of doing that. The same thing happened too with people who were waiting to get called back when they are in quarantine or home quarantine and so on to pick up gadgets and devices from them.
Okay.
I think we must do something better about keeping in touch with the people we have waiting and stop frustrating them.
Okay.
Because this is not helping with the whole interest in immunization or vaccination, correction.
Thank you very much, ladies.
Blossom, as I told you, for some reason it might be my connection and I think, but I am not hearing the caller. I'm not even here. I heard North Lyons well, but I did not even hear when PS was making a presentation.
Blossom, can I speak?
Sure. Mm-hmm.
So I want to thank the caller for his suggestion. I think it's something that we can take on board as it relates to setting up a system for the callback and keeping in touch and let persons know what is happening. As we go, we grow because this COVID thing is new for us. And we take all suggestions and we analyze it and we do what we need to do, in order to improve what we do. I just wanted to assure the caller before that we are taking steps to care for our elderly. And that is why the Richmond Home, which is the elderly home, government elderly home, we have now invested with CAHO about approximately $1 million in retrofitting the Richmond Home and making it smart and elderly friendly for elderly citizens. We want to ensure that our citizens, no matter what happens, natural disaster or so, this building can withstand any form of natural disaster and ensure that our elderly citizens are protected. But we have gone beyond that to ensure that the facility is now elderly friendly. So we're providing all of the basic things like one of the callers would have spoken about for the disabled. So the bathroom facility would be accessible to persons with disability. The walkway, the bathroom would have your guardrails and all of that to ensure and secure our elderly citizens.
A WhatsApp question. Somebody is asking, after hearing about the brand new wing and equipment, can you tell us about the maintenance plan? Are there scholarships available for Grenadians to learn to repair the equipment, or will they be allowed to get into a rundown condition again as we are seeing now?
Thank you, Blossom. Yes, and we too have identified that we are equipping facilities and we must put system in place for that. So we have now going to Ministry of Education because the scholarship desk is assigned to that ministry. So we are going to be having discussion with the Ministry of Education as it relates to how do we get our personnel trained and be available to be able to provide that services. I must say, we have 2 young men presently at the hospital who came from the Imani program attached to our biomedical department. And it's amazing to see the capability of these young people. So we must invest in them.
Facebook question. As it relates to Mount Gay, has the situation improved in terms of security for patients? And what is the status of the investigation as it relates to the rape allegations?
The status as it relates to the rape allegation is a matter with the Royal Grenada Police Force. So we have not been updated on where they are as it relates to that. We have continuously worked to ensure that we provide security and to deal with the issue that confront not only Monge Mental Hospital, but all hospitals. And so we'll be continuously working to improve the different services that we provide as a government and as the Ministry of Health.
All right, no phone lines, so let me go back to WhatsApp. Somebody on WhatsApp is inquiring. We have seen a number of our rest in peace notices on social media in relation to a number of young people passing away over the past few months. Is this a major concern for the Ministry of Health that our young people are dying like flies?
Young people are dying, yes, and there are different reasons why young people died, and some issues are issue of cancer and other healthcare issues, and some of the issues are our education process, because the thing about cancer, in most of the cases, if you detect it early, so we have to use the education aspect to let our women know that you have to do your self-examination, your breast check, your pap smear and all that yearly, so that in case there are any issues as it relates to those organs, they can be dealt with early. So we are continuously using our health promotions to reach out, and we have our healthcare facilities whereby our women can check themselves. So we continue to urge our women to do their self-checks and to do the pap smear and all those things. And men, prostate issue. One of the issues we're seeing is that a lot of young men in the 40s and 45 and all that are coming down with issue of prostate. And so we're also encouraging them to get checked. And as we said earlier, we now have Dr. Tristan who is working with us, but we do not want to wait until you reach Dr. Tristan's level. We want you to take your check every time, every year. We find people wait until they get very sick. People, men especially, it seems like they're afraid doctors, so they do not go to check up. Even when they're feeling something, sometimes they say it's gas and all that, when it's something else that can be prevented. So we want to urge our people to take those necessary steps that will help to prevent and help to identify at an early stage any issues that confront us. Some of the diseases are lifestyle diseases. So we have high blood pressure and we have diabetes, but these are diseases that can be controlled if you take your medication, if you exercise daily. So we have to urge, there are too much sedentary jobs. So our jobs are sedentary. And so we sit down whole day, and then when we reach home in the evening, we sit down in front of the television and eat. And so we have to encourage our families to get some means of exercise, a half an hour a day, maybe in the evening or first thing in the morning. We also want to encourage them to eat healthier. So a lot of times we think eating healthier is a lot of meat on our plate, but the less meat and the more vegetables and the more local foods, our bananas, our blogo, our pumpkin and our callaloo, which we can get in the backyard, are healthier for us. And so we will continuously encouraging in the months coming. We'll do forums at the level of the community health. We already started in some instances before COVID. And so we'll continue to provide those education so that people and families even children at school, even at the level of the school where you provide fruits instead of those sweet and fried stuff. Too many times we find workers coming to work with a box. So instead of they come with a packed lunch, they go out on the street and buy the fried foods. Some of those deep fried foods is not healthy for us. I mean, you may do everything in moderation, but we want to encourage you to eat more healthy fruits and vegetables and more of our local grown foods that we can grow at our own backyard.
Somebody on WhatsApp says, did the PS just say the government spent $1 million to retrofit the Richmond home? Wasn't that funded by the British government?
Yes, and I said that project is being executed in collaboration with the Pan-American Health Organization. Yes, the money is coming through. It's a fund from the British government.
And Minister, well, all of you as well as the person who asked the question on Facebook in relation to the Hilarion home and the pot, there are two people on WhatsApp who says that report is untrue. Somebody said they spoke to a caretaker or a supervisor at the home. I'm trying to look for the comment. They spoke to a supervisor at the home and the supervisor said that is not true. And somebody else says their aunt is the cook at the home and she says it is untrue. So the person who was inquiring about the pot, according to two people on WhatsApp, it is untrue. So maybe you can double check the information as well as Minister PS, double check to make sure all is well with the Hilarion home. Ladies, thank you so much for stopping by. Unfortunately, we're out of time. Ms. St. Paul, I know you still had some plans to share with us this morning, but hopefully next time when you stop by, you can update us and give us some more information on those other plans of the ministry.
Blossom, we want to thank you for having us, and it's always a pleasure to update the nation and to say that as the Ministry of Health and as government, we are committed to not only improving the services, but working with our staff to improve the working condition and those issues that confront our staff. Very soon, we will engage with Prime Minister and the other stakeholders as we really seek to address. And we are committed. I want to stress that we are committed to deal with those issues, and we are continuously meeting and looking at, and we have continuously been regularizing, and just last year we had 40 persons being made permanent, and we continuously looking at that and looking at ways and means to deal with the issues that confront our healthcare professionals, not only our nurses. And so as we continue and we develop those policies and those plans and to implement them, we will let the public aware of how we move forward. But we are committed and we will do what it takes. We appreciate that our nurses and our healthcare professionals are working hard and going beyond the call of duties. And so we will work with them to deal with the issues and challenges that confront them at this time.
All right. Thank you very much, ladies. Enjoy the rest of your day. Continue to stay safe.
Thank you.
All right. Oh, before we go, Nurse Lyons, the team that will be in Grenville tomorrow, please, Lord. Any idea? They'll be at tomorrow, please, Lord. Friday is at bus terminus. Tomorrow, the
Friday is bus terminus. Later this afternoon.
Go ahead.
Later this afternoon, the meet and greet.
No, the poster from the ministry says there'll be the vaccination teams will be in Grenville, but it didn't specify which part of Grenville. Tomorrow, please, Lord. Tomorrow, Thursday.
Friday, so maybe that was an error. Friday, the 30th.
Okay. Okay, so they're not in Grenville tomorrow.
Friday.
Okay.
No, Friday the 30th.
All right.
And just want the general public to know before I leave that the nurses at this time of the year, we normally go to the schools and vaccinate the 14-year-olds with tetanus, against tetanus. Okay, so they'll be expecting the nurses at the secondary school also to vaccinate the 14 and 15-year-olds against tetanus.
That's this week?
Yearly activity. Yes, this week.
Okay.
And if they don't achieve it this week, they'll go into next week, please, Lord. Remember, vaccine works.
Yes, PS.
Allow me to say thanks to a hard-working team of healthcare professionals within hospital and community. We have seen what our healthcare professionals can do We have seen it manifested in COVID and the ability for Grenada to be able to control this COVID pandemic. So I just want to express my sincere gratitude to each and every one of them. The community health nurses, they have been going and going tirelessly, and we just want to say thank you to them. And we continue to make all strides to ensure that we provide what is needed for you, be it permanent status, remuneration, whatever it is. We know we are working on that. It may not come fast as you want it to, but we assure you that we continue to look after your well-being. And just want to say thanks again to all of them.
Thank you very much, ladies. Enjoy the rest of your day. Officials of the Ministry of Health, we had Minister Delma Thomas, Permanent Secretary in the Ministry, Hannah St. Paul, and Immunization Manager, Nurse Audrey Lyons. We thank the three of them for being our guests this morning, and thank you, viewers and listeners, for tuning in. Mid-Morning Buzz is up next. I've already stolen 3 minutes of their time. I'll be back tomorrow morning, God willing. Enjoy the rest of your Wednesday. Continue to be COVID-19 smart.